I'm Dr. Lora Shahine. Welcome to my YouTube channel. Today, we're going to talk about who should freeze their eggs. I'm Dr. Lora Shahine. I'm a reproductive endocrinologist helping people build families, preserve their fertility, freeze eggs for over 15 years. Today, we're going to talk about who should freeze their eggs. Egg freezing is a really important topic, and there's a lot to learn about this option. You may have seen me post about it on Instagram or TikTok. I really want you to learn about this. YouTube is exciting because I can, in a little bit of a longer form, I can share a lot more information about this topic. So please like this video if you find it helpful, comment with questions that you have, and subscribe to this channel so you can continue learning. Egg freezing is basically doing IVF, in vitro fertilization, with a pause in the middle. So you go through the stimulation in order to recruit multiple eggs and do an egg retrieval. So the eggs are outside of the body. And then instead of fertilizing with sperm, creating embryos, and then transferring an embryo to the uterus in order to get pregnant, so you think about the entire IVF cycle, when you get the eggs out, you actually freeze them, and they're waiting to be fertilized and turned into embryos and cause a pregnancy until the future. And it's an incredible option for people who are not ready to conceive, but realize that with age and with time, fewer and fewer of the eggs are able to do all the genetic work that they need to in order to turn into a healthy pregnancy. A little history about egg freezing. In the beginning, it was really reserved for people with a cancer diagnosis. So it was not what we think of it today as sort of fertility preservation for anybody that wants to delay childbearing. So in the beginning, egg freezing was really only offered to cancer patients. It was considered experimental, and it was an option for patients that were undergoing treatment that might decrease or even eliminate fertility in the future. So treatment of cancer can include chemotherapy, radiation therapy, or even surgery, where people can lose egg function. They can go into menopause and not be able to have children in the future. And so egg freezing was this opportunity to get eggs out of the body before the toxic treatment to the ovaries and preserve someone's fertility. As we learned more about egg freezing and saw how incredible this technology is and got more experience with it, we really started to open up egg freezing to anyone that wanted to delay getting pregnant for any reason. So instead of only offering it to cancer patients, it started to be offered to people with other reasons. You might think of egg freezing more of like delaying childbearing for a focus on career, or celebrities will talk about egg freezing. And it's really kind of this empowered, incredible option. It's a way to take back control of fertility. As you know, as we age, it's harder to get pregnant. There's a higher chance of miscarriage, higher chance of Down syndrome. The eggs don't work as well as they age. We're born with the same eggs we're going to have our whole life. And when we're born, our eggs are frozen in this genetic state. And it's when we ovulate, whether we're 21 or 41, that the eggs have to get rid of half of their genetic content in order to fertilize with sperm. And so the older the eggs are, fewer of them are able to do that genetic work. And if you have an egg that has an incorrect balance of chromosomes meeting a sperm, you can maybe not get pregnant that month, or it's the most common cause of first trimester miscarriage. And so it's just harder and harder to get pregnant as we get older. And so the thought is if you can freeze your eggs when you're younger, and more of those eggs are better quality, more viable, more successful when you go to use them, then you are preserving your fertility. And so this incredible option, instead of just being offered to cancer patients, it's really opened the door for anybody that is not ready to have a baby to preserve their fertility and get pregnant and have their family on their terms. I'd say the most common patient that I see is someone in their mid 30s who, had always wanted to be a mom and always imagined, that is in their life and what they want to do, but they just haven't found the right partner yet for whatever reason. And so they want to freeze their eggs and kind of release that time pressure valve of stress. Like every time they meet someone, they're like, oh my gosh, is this the one? And let me think, like, we got to be together for 6 months, and we got to be married for 6 months, and then I'm going to be 38, whatever it is. People really talk about how wonderful it is to kind of relieve a little bit of that pressure. But I see people freezing their eggs for lots of different reasons. Some patients with endometriosis will freeze their eggs. Endometriosis is an inflammatory condition associated with painful periods, pain with intercourse, and sometimes infertility. And sometimes it's best to freeze eggs young because endometriosis often gets worse with age and time. Also, one treatment for pain with endometriosis is surgery. And when you do surgery on the ovaries, if there's a collection of endometriosis in the ovary, it's called an endometrioma. Sometimes when you remove that cyst, that endometrioma, sometimes you take good ovarian tissue with good eggs with it. And so sometimes people, before their endometriosis surgery, they will actually do egg freezing to just preserve fertility. So really, the answer to who should freeze their eggs is anyone that wants to preserve their fertility and keep their opportunities open. Of course, it should be discussed with cancer patients that are getting ready to do treatment that can be toxic to their future fertility. So freezing eggs before that treatment can keep options open for the future. Of course, it could be discussed if people are getting ready to do surgery on their ovaries, like maybe for endometriosis, because you can freeze eggs before that surgery and just have options open for the future. And other chronic illnesses that might get worse with time, you can freeze your eggs when you're at a younger stage. But honestly, for anyone that is just thinking that they are not ready to get pregnant and they know that time is not on their side, when it comes to egg quality and chances of conceiving, if you're at all thinking about it, have a consult. It might not be the right thing for you, but if you're at all thinking about it, you're curious about it, have a consult with a reproductive endocrinologist like me. It doesn't mean that you have made a decision and that you're ready to freeze your eggs, but it might just be a fertility checkup. You might do some testing. You might kind of look at the big picture. I talk about, if you came to me for a consult for egg freezing, it doesn't mean like, oh, I've made a decision, Dr. Shahine, sign me up. I'm going to do it right away. We kind of like look at your age. We look at your family goals. We look at your ovarian reserve testing. We do ultrasound and an AMH and FSH and estradiol. There's different ways to kind of look at egg supply and egg quality. And we can kind of take that whole picture and sort of talk about if egg freezing is right for you. So anybody who's thinking about it should have a consult. It's open to anybody. There are pros and cons. I wish that egg freezing was a guarantee. I wish that if you froze eggs, it would automatically mean that they work in the future. It's really important to go over lots of details with your doctor and kind of understand the process, because you're freezing an opportunity, you're investing in yourself, but you never know if it's going to work until you go to use them. So really get great, thorough counseling. I hope this video was helpful. I hope you learned a little bit more about who should freeze their eggs. If you're at all thinking about it, just make a consult, get that information. It doesn't mean that you have to do it, but you're going to be more informed and make an educated decision. One regret that a lot of my patients have is, I've been thinking about doing this for years, Dr. Shahine, and I just wish I'd come and talk to you sooner. So just, if you're thinking about it, just get that information. Like this video if this is helpful, comment with questions that you have, future topics that you want to go over, subscribe to this channel so you can keep learning, and stick around for more videos.